So difficulty in swallowing is a common problem that people suffer from. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Dirito, a family physician. Today we'll be talking about difficult swallowing, or what is known as dysphagia. Difficulty in swallowing can happen because of two main issues. There could be problems in the mouth and the pharynx, and there could also be problems in the esophagus. The problem that can happen at the back of the mouth include infections like tonsillitis. You can also have sores on the tongue. You can have lesions on the tongue. You can have a foreign body on the posterior part of the mouth. You can have an infection of the posterior part, what we call the pharynx, with an abscess. You can also have lymph nodes around the neck region causing pressure around the neck region. And you can also have nerve problems, especially for persons who have had a stroke. On the part of the esophagus, some of the things that can cause difficulty in swallowing include the presence of a foreign body on the esophagus, strictures, that is narrowing of the esophagus. You can have erosions of the esophagus, either from infections or even from injuries, like from food as it goes down. You can have what we call a hiatal hernia, which is the sliding of the esophagus around the region of the diaphragm. You can also have loss of nerves on the esophagus due to problem with the nerve problems. And you can also have conditions that affect nerve and causing the absence of nerves in some part of the esophagus. So the signs and symptoms of difficult swallowing include pain on swallowing, inability to control the movement of food down the esophagus, leading to dribbling. Sometimes you can have aspiration, whereby food goes to the long opening, like the airway, and this can cause coughing. You can have weight loss and especially loss of fluids due to inability to swallow. You can have voice changes, especially if the problems are happening at the posterior part of the mouth. You can have pain when swallowing. The diagnosis is dependent on the patient presenting symptoms and also the kind of difficult swallowing that the patient have. You may have patients who have progressive loss of swallowing, whereby they start with difficulty swallowing liquids, then this progresses up to a point that they are not able to swallow liquids. You can also have, especially if they have problems with nerves, then the problem will start with the difficulty swallowing liquids, because liquids are not able to move themselves down the esophagus by gravity. So the treatment is dependent on what is the cause. Most of the times we have conditions like reflux from the stomach, and this can be treated with drugs that reduce the acidity and help to prevent the reflux. Of course, if there are abscesses and infections on the upper part of the gastrointestinal system, then they need to have those treated. If they have things like abscesses and erosions, you can treat that with the antibiotics. For those who have neurological problems, then treating the underlying problems will help to help with the swallowing, especially like for patients with stroke. Then helping with the soft solid food that can be able to be swallowed easily. Then also, if you have conditions like growth on the esophagus, some of these patients may need what we call stenting, whereby you put a tube to help open the airway, the esophagus, so that food can go down. Of course, if they have things like foreign bodies, then those ones need to be physically removed. So how difficulty in swallowing is managed is dependent on what is the cause. Is it caused by problems on the upper airway? Is it caused by problems in the esophagus? and some of these might need intensive intervention like endoscopy, so that you find the cause of the difficulty in swallowing, and then the treatment will depend on whether you find things like growth like cancers of the esophagus, which may require treatment for the cancer, and also processes like we call stenting, whereby a tube is put in the esophagus to help the food to go down the esophagus. So thank you very much for listening.